Hello, and welcome to the webinar presented in collaboration with Connecticut, Delaware, New York, Pennsylvania, and Virginia MGMAs. Today's presentation is led by Melody Butler. Melody is a mother of four and a registered nurse. She works on Long Island, New York as an infection preventionist with previous pediatric nursing experience. In 2011, she founded Nurses Who Vaccinate. She serves in advisory roles within national public health organizations such as Voices for Vaccines, Every Child by Two, and Shot at Life, and a United Nations Foundation campaign. She is currently serving as a member of the National Vaccine Advisory Committee. Melody is dedicated to helping children everywhere lead happy, healthy lives. Please welcome Melody Butler.
Thank you so much for the introduction. My name is Melody Butler, and I'm an infection preventionist. I am currently at the APIC conference right now, taking place in Philadelphia. So if you hear a lot of background news, it's probably my fellow colleagues very excited about hand hygiene and new practices to combat antimicrobial resistance. So with that said, I'm going to get started with the presentation. I have no disclosures. And the objectives of today's webinar is to summarize what is going on in social media, talk about the mainstream news. We're going to come up with a way for you to feel comfortable with addressing common vaccine questions and be able to address concerns. And I'm going to provide you with vaccine advocacy tools that could be used on social media for one-on-one interactions with your patients and colleagues in the workplace. Okay. So, so as healthcare providers working in the facilities that you guys work for, there is always an opportunity for us to advocate for vaccines. I advocate for vaccines by walking the walk and talking the talk. I educate patients. I also vaccinate my own children. And I'm a vaccine advocate within my community. I have hosted, I am the chair of the PTA Safety Committee here on Long Island in New York. I have held flu shot contests, and I also share my own personal story about how I got involved with starting Nurses to Vaccinate. And just really quickly, what happened was in 2011 we had a massive flu pandemic with H1N1 to the point where New York State wanted to mandate flu shots for all the healthcare providers. And if you did not get a flu shot and you worked in a patient care facility, you were going to be terminated. So I did some quick literature review online, and I came across some very scary stories that really did not make me feel very confident in vaccinating. So what I did was I spoke to my nurse manager and my nurse educator, and I told them that I wasn't comfortable getting this vaccine, that I was prepared to get fired if I needed to be. And my nurse educator was very kind, and she sat me down and she looked at what I was looking at. She was able to pinpoint what was wrong with what the websites I was looking at and how they were just really trying to scam me. They pretended to have medical credentials, but when you explored them deeper, you found out that they weren't being ran by anyone who had the authority to say anything about vaccines. A lot of the information on there was outdated, inaccurate, hadn't been updated. It was theories as opposed to evidence-based research, and I became very upset with how I was scammed. Fast forward a couple years later. So that was in 2008 with the flu shots, 2009 with the H1N1 outbreak. In 2011, I came across a Facebook page with nurses who were sharing misinformation on the internet. They were called Nurses Who Don't Vaccinate, and I thought I was doing them a favor. And I messaged them and I said, hey, what you're sharing is inaccurate, and I have the right information if you want to put that out instead. And that was my first exposure to the anti-vaccine world, when they were not very receptive to my education. And I learned very quickly that some people are not interested in what we have to say as the pro-science side. So with that said, I was in the mood, so I decided to create my own page called Nurses Who Vaccinate, and with that, the organization has now become over 1,000 members. We're all over the world. Nurses, parents, vaccine advocates, we all work together to make sure that what we're doing is, we're being able to be present in not only our workplace, but in our community and on social media as well. So now, the next slide. And when I speak about social media, it's so important that we're present on social media because social media is here to stay. Social media has an effect on patient decision making. People are going to be using Google before they call their providers, and even ourselves, we might be guilty of that. We know in general that people also seek out people who think very similar to themselves. There's, the social media definitely helps to power confirmation bias. However, with that said, social media is a conversation and it's dynamic. You want to be sure you're using social media that you're comfortable with, so don't be afraid to try new apps and networks, but if there's a particular platform that you prefer over others, by all means, you do want to use that one. There's so much to understand when we talk about vaccination conversation on social media. So if you look at the first graph that we have on there, that is a Mexican case study, and they were tracking how the flu conversation was occurring on Twitter. And you can see the beginning of that graph, it's like April, it's August. And what happens, you have those spikes. Those spikes, depending on the different color, represent Department of Health and healthcare professionals. And you see the spikes of when they pertain to flu shots are available and they're kicking off their flu shot campaign. You see that really sharp, skinny spike in the beginning. And then from there, the conversation continues. There's another spike, another thin spike later on. And then you hit the real, when the flu season really has its uptake. And that's when people start chiming in about their flu symptoms, how they feel, looking for help, looking to get flu shots last minute, like everyone, like many people, and you can just see from there, you can measure the conversation, and it really does correlate with the flu cases. And the next next graph, you see kind of like blurbs of, you're able to pinpoint who's in that conversation. The red being the healthcare professionals, and then you see like an outlier of maybe anti-vaxxers and that really far tan circle. And from there, there's various individuals, some of them are organizations who may partner with the Department of Health, maybe celebrities talking about flu shots or whatever, news articles about it, and you can measure the influence that those particular conversations had on social media. So Nurses Who Vaccinate, what we do is we make an admission to be present on major social media platforms. That way we can be there to help address any misinformation and be there so we can jump into that conversation. Not only do we want to be there to correct misinformation, but we also want to lead the conversation. Several studies have shown that the conversation on social media on vaccination is predominantly positive or neutral, and we want to keep that going in that direction. And it's not just nurses using the social media. Within healthcare, recent estimates of social media show that physicians have dramatically risen from 41% to 90%, while rates of use have been found to be above 90% for medical students. So patients and parents are asking questions about vaccines, and we want to make sure we are there on these platforms to give them the answers. So we really need to work together so we can increase the pro-vaccine chatter. How can social media help to advocate for vaccines? Well, if you look at that quick little chart I provide there, you can see the different verbiage that can be used when discussing vaccines on the different platforms. There's different ways to communicate you're getting vaccinated or to promote vaccines. For example, you can like vaccines on Facebook, you can use hashtags on Twitter. On LinkedIn, you can say the vaccination is your skill. On Pinterest, you can have a board of vaccine pictures. On Instagram, you can have a picture of yourself getting a flu shot and hashtag it called Vax Selfie. You can also, let's say, Pandora, listen to a podcast, etc. So there's many different ways to have a vaccine conversation on the different platforms. So what are the pros and cons of social media? So pros, it's an opportunity to be proactive. We have a chance to share our clinical knowledge and experiences. And we also have the ability to listen to patient stories and questions and make sure that when they're coming into the office, we're equipped to provide them with what information they need, because we kind of seen the circulating hot topics of that month circulate, about vaccinations. So we're able to address concerns and provide answers in real time for them. They're not coming up with us, if if you're on social media and you have your pulse on, you have your finger in the pulse in regards to what the hot topics are, you'll know ahead of time, okay, aluminum is a hot topic. Let's make sure we print up, Children's Hospital of Philadelphia pamphlets on aluminum, have them available. So when people have questions about them, we know what we can just give it to them. Or maybe the hot topic of this month is, too many vaccines too soon. So we can make sure we have the recommendations from the CDC available to explain how the vaccine schedule has been studied and why it's safe, and how getting them at the recommended time is the best for the patient. The cons of social media is that the public is quick to share horror stories and myths. So patients can be very overwhelmed by sensational news. Media predominantly likes to share bad news, but they are improving. And in recent years, we definitely have to say that there definitely is a stronger presence of them calling out the anti-vaccine movement and being more willing to make sure they highlight vaccine evidence-based research as opposed to personal stories. But it takes a lot of work to highlight vaccine success stories, and we want to make sure we continue to minimize the occasional bad outcome, because patients will remember that one bad story and forget the 100 good stories. So we need to make sure that we're doing our best to keep the good stories coming to increase the confidence. So why should healthcare providers like yourselves utilize social media for vaccine advocacy? We have influence. We can collaborate with one another. We can share and create educational tools, and we can empower our own patients and families. So influence, healthcare management professionals, you have a crucial role to play at all levels of healthcare. You're working directly with the patients. You can help lead policy development and implementation, and within your office, making sure everyone's abiding by the policies of proper vaccine storage and education, and everyone's using the same framework of conversation when they're educating and making recommendations. And we can also be taking personal responsibilities. You can be setting examples in the workplace, when you get your flu shot or whatever, or wearing, pro-vaccine outfits or pins. Those slight, subtle measures can make such a world of difference for that very scared, hesitant parent. You can really make a difference in whether a patient vaccinates or not. So there's been, as time goes on, we get to have more and more evidence-based research on the impact of social networks on parents' vaccination decisions. We don't just say, oh, they don't vaccinate. We're going into the nitty-gritty and finding out why, and what is the driving force behind whether a parent's going to vaccinate or not. And we learn that social networks, particularly the parents' people networks, play an important role in parents' vaccination decision-making. Conformers, people who usually conform to the recommended, we have two types. We have the conformers or non-conformers, and the conformers are the typical networks of parents who conform to the recommended vaccine schedules, and we have the non-conformers who don't. Maybe they want to delay, they're hesitant, they don't want to get it at all, and their social media networks can really play a part whether they stick within those particular types. There are a lot of interventions aimed at increasing vaccine acceptance, and we need to make sure we're focusing on communities more broadly, so other parents are likely to consult if they're consulting with their friends or with their social circle, and we're able to be in there and be present, we're developed a rapport, and we're seen as a trusted point of information. We need to make sure that we are out there and we're making ourselves known. Conversations and posts continue to have a big impact, especially the comment section. In re-examining, there was a study done where researchers showed the test subjects 2 fake public service announcements. One was from the CDC and was pro-vaccine, and the other one was from National Vaccine Information Center, which is, in case you don't know, not a pro-vaccine organization, very anti-vaccine, continuously posts out-of-date, inaccurate, dangerous misinformation, trying to scare people from vaccinating. The key to the experiments wasn't the public service announcements. It was actually in the comment sections that followed them. The comments were anonymous, and in the first section, after looking at both the public service announcements and comments, the participants were asked about their likelihood to vaccinate. The research concluded that both the public service announcements and the comment section influenced their likelihood to vaccinate. And comments that were anonymous had as much influence as the actual public service announcements. In fact, we've learned that comment sections can be so influential that Popular Science has disabled comments, and many newspapers and media sources have gone to do that as well. What could be very detrimental to our efforts is when we have quote-unquote physicians or doctors, people trying to use our medical profession titles, spreading negative news about vaccines that can undermine our public health advocacy. People take the word of mouth communications, electronic and in person, very, very serious. And we need to make sure that healthcare providers are posting positive responses and making sure that supportive comments are abundant. So if you're running a Facebook page or a Twitter page, don't hesitate to delete the spam and the negative comments. It is your page. You have the rules. You call the shots. You can leave up what you want. If you want to address them, that's fine. If someone's asking a question, but don't fall into what's called the sea lion, where it's a commenter who just constantly harasses the page and looks like they're just always asking questions. Meanwhile, they're just trying to come up with a got you question or distract you from what you should be doing. So where are patients getting their news from? So patients are getting their news from social media. The interesting data from a study conducted by the Pew Research Center showed that it is clear that majority of Twitter users and Facebook users now say that each platform serves as a source of news about not just their family events and when the next birthday party is going to be, but also issues outside the realm of friends and family. That people are now getting their news from the social media platforms. Close to 2 in 10 adults use Twitter and 2/3 use Facebook, according to the survey, but that is slowly switching as the demographics of parents change, and the younger users are using mostly Twitter and Instagram. An interesting study did show that 1 in 10 U.S. adults get news from Twitter, and 4 in 10 adults get their news from Facebook still. So when we talk about collaboration, there's many different ways we can use social media to work with one another. Using and embracing technology works. The causes of under-vaccination are many. However, patients and families' misperception regarding their need for vaccination and concerns regarding vaccine effectiveness and safety are playing an increasing role. Dr. Stockwell from NYU recently demonstrated the impact of text messaging vaccine reminders on adolescents' vaccinations and influenza vaccine for children and adults, and the results were extremely positive. So using something like as text messages and working with your Department of Health to send these out maybe can be an option if you're having a very poor follow-up, or you need to, if you decide that reminders are the best way to do that. Immunize Canada works with Canadian experts to effectively translate timely research evidence into educational tools, promotional materials, and key messages within the aim of increasing immunization rates, obviously in Canada. They've launched their own app called Immunize CA, and it's a platform that they use to help parents if they have questions. They have a FAQ, frequently asked questions section, and they have an ability to send messages and get their questions asked from the experts in the Department of Health, the Public Health Association. And the app also encourages on-time immunization with the use of alerts and reminders. Collaboration doesn't just have to be local within your state department. You can the CDC organizes Twitter chats that your department and office can work with. Also, Immunization Action Coalition always puts out their newsletters, and that's something that can be printed out, displayed, whether it's in the workplace with colleagues or patients. And also on a global level, if people want to know what's going on, the Gavi Alliance, Shot at Life, they're great organizations for us to get involved with to learn more about what's happening overseas with our neighboring partners. Also, collaboration helps us to collaborate within our own inner colleague circle. We could be reaching out to our students, faculty, administration. There's so much that can be done in regards to collaborating online. We found that nurses working in administration also benefited from benefits of social media use. They were able to connect Twitter users in conversations with healthcare policy. And they were able to band together, and they were able to connect with each other to exchange information, and they were able to help pass some laws and educate nurses on up-and-coming legislation that would affect them personally. The fastest growing demographic of users of social media is the 35 to 55 age group. So we do have plenty of educational tools on the internet that are available for vaccine advocacy, but unless you know about them, you're not going to use them, they're not going to help. So the Voices for Vaccines, which is a family-driven advocacy group, they provide toolkits for people to use if they want to have a vaccination seminar or Q&A session at a PTA meeting or at a parenting group. They have a Kick the Flu Out of School toolkit if you want to have a flu shot contest. Where they work together with Families Fighting Flu and the School Nurses Association to come up with that. The CDC has health e-cards that allow the public to send electronic greeting cards to friends, family, and coworkers. And one of these things, what I've suggested to people, what people or not, our patients have done, they've gone to the e-card that recommends that visiting family members for a family with a newborn, they recommend that the visiting family members get their flu shot and Tdap prior to visiting the baby. And on the postcard, it's something that can be sent electronically, and it's also can be printed up and included in the birth announcements. So we are able to share this information by quick, easy to print up birth announcements you can print off from the CDC. There's videos available that you can use and share from Every Child by Two, Vaccinate Your Family. Quick, easy to understand, 30-second, 40-second snippets you could feature on your websites for your healthcare facilities. And there's also action alerts. Often there's a lot of legislation that can personally affect us. And if you're, it's very hard to keep up with it all. So by making sure you're subscribing or in touch with colleagues who are on the involved with legislation, you can make sure that nothing's being passed on your Senate or Assembly without your knowledge. And there's so many other things that are available. So we talk about legislation. That brings us to our next slide. You can be an advocate for science-based vaccine policy in your state and on the national level. VaxAdvocacy.org is a website provided by parents who want to help others speak up for sensible science-based public health policy. They're a great resource. Also, I highly recommend Vaccinate Your Family. Vaccinate Your Family. They will, if you are interested in learning more about what's going on in your state and being a participant, reach out to them. We have excellent legislative advocates who can help break down and keep you up to date on what's going on there. So I highly recommend the Vaccinate Your Family. For those who want to do more of a global outreach, the Shot at Life has a mobile app that helps parents tell the story of their child's first by capturing pictures and in their childhood moments from ages 0 to 5 years, the milestone tracker, all while helping to build awareness about the Shot at Life campaign and the life-saving vaccines that help give children around the world a shot at a healthy life. So this app is a great way for parents to keep track of how their child's development is going, at the same time helping them to realize that not every child is going to have the access to healthcare they do, and we need to help those who don't. That's a very good app that I suggest some parents use. Also, a good advocacy tool that I like to personally use is called Charity Miles. When you go running, you just sign into this like you would for Map My Run or anything else, and for every mile you run, a vaccine can be donated in your name to the UNICEF. So that's that little inspiration if you need to keep going for that last mile for your 10K. It's definitely a very cute app to use, and when you're done, you can post it to social media and post it to your pages. I know some organizations have had group runs, and everyone signed in, and they were able to share their achievements and share that they, as a group, not only ran a race for keeping healthy, but they also were able to advocate for global health. And we want to make sure that with our vaccine advocacy, we're doing everything we can to empower our patients. Not only do we want to vaccinate them, not only do we want them to be comfortable when they vaccinate, the ultimate goal is to give the patient and family a strong vaccine education foundation. That way, they themselves can become public health and vaccine advocates. By strengthening their understanding, we'll help those hesitant parents be able to speak up when they're on the playground and in places we can't always be. And then always they can help to refer other vaccine hesitant parents to qualified healthcare professionals and not rely on misinformation. We've been able to empower patients and their families so much that we were able to make a video in collaboration with Voices for Vaccines, showing off our lovely patients and their kids being such great advocates for vaccines. We've also been able to had guest blogs where patients themselves contributed to and thanking the staff members for being patient to talk to them in regards to vaccine education, where they volunteered. They were like, you know what, I'm so glad you did this. You took your time to educate me. I feel inspired to share my story with how patient you were in educating me and letting others know that you guys are a safe place to go to if I have vaccine questions. So how do we want to use the social media? We want to make sure that we're being proactive. We're countering misinformation. We want to learn our audience. There's certain ways we can do this and we can educate using the case method. And we want to make sure we always remain professional. And I'll get into some of our success stories a little bit. So some proactive approaches that your organization can take. We could be writing letters to the editor, opinion editorials, op-eds. If there's anything going on in the news at the perfect time. Right now in New York, we just passed legislation that helps strengthen our vaccination rates for the public schools. And also being proactive, we connect to colleagues and healthcare providers and online communities. We can connect to legislators directly about current healthcare bills and initiatives. We're also able to collaborate in organizations, forums, and brainstorm with one another. Sharing evidence-based practices and joining public health organizations on their social media pages as well. Most Department of Health do have a Facebook page, Twitter page I'm sure they would really appreciate collaboration with you, with private organizations and in offices. That way we can share the message together and help amplify the positive vaccine stories on the internet. Proactive approaches such as an op-ed, it is so important that we share our personal story. We want to like I said, we want to make sure our subject matters are timely. They're on the hot topics, whether you're dealing with measles in your area, if it's Infection Prevention Week. Maybe you have a family who just moved from another country and they dealt with polio directly. Maybe if they want to share their story of how they felt about that. Make sure you have a clear structure. Usually it's less than 1,000 words. You would have key points and have a plan and call to action. What is your message of that op-ed? Do you want the readers to do something, or is it just educational? When it comes to countering misinformation on the internet, this is a big thing. We want to make sure, though, we remain graceful and professional at all times. We want to make sure we are keeping our cool, and we learn who to ignore and who our audience is. We want to leave the door open for others to ask questions, and we want to be able to direct the audience to credible sources. So if we are maintaining a professional aspect when we're dealing with the anti-vaxxers on our websites, that shows that anyone who's on the fence, or anyone who's just has a simple question, that we are a credible source, and they can come to us and not feel anything, and not feel pressured or being judged. Because it's okay to have questions. We want people to have questions. We just want them to make sure that they know that the proper people to ask those questions, as opposed to going elsewhere. When it comes to knowing your audience, this is a handy guide of the different levels of vaccine hesitant parents. You have the top one, where they're uninformed, but they want to become informed. Maybe this is a brand new parent, and they just want to make sure that they're adhering to the schedule correctly. And they're like, oh, do I need all these vaccines all at once? And they're kind of they're open to what your suggestions and the recommendations are. The next type would be the misinformed but correctable, where they think they have an idea, where they feel maybe, I'm going to hold off on getting the Hib vaccine until next time we visit. And then you explain to them that, being a newborn, 2-month-old, 4-month-old, you don't really want to wait for the Hib vaccine, because this is the most crucial time for them. You have the third level, where they're well-read, and they may have some literature to back up their stance, but it might not be correct, or it might have been cherry-picked to the point where it's maybe an opinion piece as opposed to a study, but they're open-minded and they're willing to have a conversation. You have those who are convinced and content, and they don't want to vaccinate, and no matter at this point in the conversation, they're not going to, but it's still important to keep that open door. And then you have the last level, where they're committed and they're a missionary, and they're just married to the cause, and there's no changing their mind. So the reason I share these 5 levels, these 5 types of parents, is because we really want to focus on the top 3. You could, by all means, if you feel courageous and you have the time, you want to talk to the convinced and content, you want to leave that door open for them to have a conversation. God bless you, and Godspeed. And I do that myself, but not everyone has that time, energy in the patients. And my advice to you is if you don't think you have the patience in you to deal with that, then don't, and just end the conversation. It's okay to walk away from a conversation. Don't always feel you have to have the last word. And the reason for that, because you want to know your audience. What do they want to know? What is the key points? You want to make sure you understand their fears, their knowledge, their trust, their experience. And we want to aim the conversation towards legitimate concerns. Sometimes you can be peppered with, 20 questions at once. Focus on one point, get that point through, and then deal with it from there. You also want to speak to the middle and not try to engage extremes. The way you lead the conversation with those extremists, though, will influence the way that those who are silently observing view the issue and the evidence. So if you're patient and you're kind when you're talking to a vaccine-hesitant patient, you never know who's watching, who's listening, who's reading that particular post. It can definitely open the door to others coming to you with legitimate questions and then hopefully vaccinating. And then the last point is, how many are actually silently observing or lurking? Well, we have a study that shows that the audience is always larger than it appears. So you may be talking, so there's what's called the 1% rule. And the 1% rule is a rule of thumb pertaining to participation in the internet community, stating that only 1% of the users of a website actively create new content. Like that means commenting, responding, liking, while the other 99% of participants only lurk. That means they see what you said and they're scrolling by, but they're going to remember that. Variance on the 1-9-90 rule, sometimes called the 99-1 principle, or the 89-10-1 ratio, states that in a collaborative website such as a wiki, 90% of the participants of a community only view content, 9% of the participants edit content, and 1% actively create new content. And when you understand who's actually reading your comments and who else is there besides the ones who are commenting, then you can proceed with how you want to comment. And what I usually do, this is my favorite part of the presentation, this is when I get to teach you how to talk to vaccine hesitant parents. So what I really advocate is the CASE method. And the CASE method combines emotional and scientific talking points aimed at swaying parents' emotional response regarding vaccines and helping them to face the issue more logically. The CASE method was created by the Autism Science Foundation, the founder who's Allison Singer, and it gives the healthcare provider an opportunity to share why vaccinating is important to them, and it also share why it's important that the patient and their family vaccinate. The CASE method allows the nurse, the healthcare provider, the vaccine advocate to share their story with science. It is through sharing our stories that we can relate to the patient and have a positive influence. So there are 4 steps to the CASE method. The first step is C, corroborate. The next one is A, about me. 3, S for science, and E, explain, advise. So for the first step, when you are corroborating, you want to acknowledge the parent's concern and find some point you can agree on. You want to set the tone for a respectful, successful talk. 2 is going to be about me. You're going to describe what you have done to build your knowledge base and expertise. And 3 is the science. You're going to bring in what the science and evidence-based research says, and then you're going to end it with your advice and your recommendation based on the science. So for the CASE method in action, here's a quick scenario that actually has happened, and I wrote it out for you. So the patient goes and says, I'm nervous about the flu vaccine. I have heard from some websites that some people skip it because it gave them the flu. Should I give the vaccine for myself and my children? So C, you're not going to jump in and say, yes, get the flu shot, science is safe. No. You're going to take a step back. You're going to plan your response. And C is you're going to corroborate. So you're going to address their concerns. I understand you have concerns. There is a lot of conflicting influenza information on the internet, but it's important to know not all of it is accurate nor up to date. Now, A, how do you know this? What makes you the expert? You're going to say, A, I have educated myself about the dangers of influenza virus because I want to be able to help my patients make healthy decisions for themselves and their children. I've cared for very sick children, previously healthy children in pediatric intensive care units. When they recovered, the parents vowed to never skip the influenza vaccine again. That was your story. That was your about me. Then an S. There is a lot of science behind the safety of the influenza vaccine. It is scientifically impossible to catch the flu from the flu shots because the virus is used because the virus that is used is sterile and dead. In order to make you sick, the virus has to be able to replicate, which it can't in the vaccine form. As a nurse and a scientist, I trust the science. And then E, you're going to wrap it up with your explanation, your advice. I vaccinate myself along with my children. I want to offer the same protection to you and your family. Thus, I strongly encourage that you get the vaccine. So this, going back to the case method, I use this for so many things. It really helps you sometimes, because sometimes you can be put on the spot, and like even myself, people know I'm a vaccine advocate, and sometimes I'll be approached at a PTA meeting, or maybe at my child's ice hockey game. They'll come up to me and be like, "Oh, by the way, what do you think of the HPV vaccine? I heard some scary stuff." And sometimes you're put on the spot, but having this framework of conversation can really help gather your thoughts together and kind of set the pace of how the conversation is going to go. So the next slide is some quick digital professionalism's do's and don'ts. Do remember that we as healthcare providers and nurses have an ethical and legal obligation to maintain patient privacy. So no matter how silly or how funny or alarming a question may be or a story may be, we don't want to be sharing that on social media. Be aware of and comply with employee policies regarding use of employer-owned computers, cameras, and electronic devices. If you belong to a network or a bigger healthcare system, make sure you are familiar with what their policies are before you engage with social media representing them. And you want to make sure we maintain professional boundaries in the use of electronic media. So the digital professionalism don'ts. We want to make sure that we do not transmit any electronic media on any patient-related information or name, image. We want to make sure we refer to parents. Patients don't refer to them in a disparaging manner, even if they're not identified, and don't make disparaging remarks about employees or fellow coworkers on the internet, even if they are anti-vaccine. My advice to you is if you wouldn't say it in church or in the frozen food aisle of your local grocery store, don't put it online. Some examples of our success stories. We over there, Nurses Who Vaccinate, we've met with Jo Frost, who you may know her from being the super nanny. She's a major global health child health advocate. And she came together, she joined Child Life after seeing their efforts on the social media pages, and she wanted to do more to become a part of that. You can see that we shared a story about a child who had an unfortunate death from the flu. When sharing that story on our social media page, we had about 12,856 reaches. So that means those were people who had not seen that story, and they were able to learn about we are able to see from our social media how many people are engaging and reading that story and clicking on it. Another comment down below, you see that it says, as of today at 3 p.m., all my kids are caught up and fully vaccinated. A year ago, they had no vaccines at all. I'm pretty proud of that moment. So it's one quick comment about the success we've had through online advocacy. There's another one right here. It says, on another note, I want to stop by and offer my sincere appreciation to everyone in this group. Had I not found this group, I may not have had the confidence to reevaluate my vaccine stance. And as a result, my daughter would continue to be unprotected. I made the decision to start catching her up in January, and she has currently received at least one of every vaccine. Thank you, guys. And that came in part with us working with another parent advisory vaccine group, and we had an open group where people were allowed to ask questions and feel comfortable, and we weren't snarky. We made sure we were polite and cordial and whatnot. Some other examples of vaccine advocacy, we all took our flu shots for Nurses Who Vaccinate, and we took a selfie and we posted it above, and we used it as our banner for our Facebook page. And over there, we show a picture of the Academy Pediatrics on their stance on how vaccines don't cause autism, and the audience reach that we had from there. We've had great social media. We have been able to reach out to legislators, and here's an example where Colorado was able to achieve an immunity rate transparency bill, which means they were able to finally have access to that information of what the immunization rates for certain schools were. They didn't have that access previously. Another example is in New York, one of our nurses, Patty Wolkowitz, she started her own foundation, the Kimberley Coffee Foundation, after her daughter died from meningitis B vaccine. She felt so empowered and motivated after her daughter's death. She was not aware that there was a second vaccine available for meningitis, the meningitis B. So she went out on New York, Capitol Hill, and she campaigned, and she was able to add meningitis as one of the required mandatory vaccines needed for adolescents and young adults. You can see her daughter's picture there. She's a very hardworking mother who I owe so much to, helping New York really come together. And some other very recent legislation success stories. Just yesterday, we had New York ended their religious exemptions for vaccines. And that was a huge social media partnership with American Academy of Pediatrics, NAPNAP, which is the National Association for Pediatric Nurse Practitioners, and we all work together to educate our members and the public about how important it was to call our legislators and call them often and make sure that we were sharing all the key talking points. And there's other examples on Voice for Vaccines. You can see how influential social media can be. You have many stories of previously anti-vaccine parents coming around and then feeling comfortable after talking to colleagues and healthcare providers online, and they finally decide to update and get vaccinated. So social media is transforming the world of patient information. Your tweet, your voice, your post, a comment matters. Communication between healthcare providers and the public is vital in the world of social media. If they're not getting their medical information from us, there's no guarantee that the information they receive is going to be evidence-based or factual. Healthcare providers need to be front and center, because if we're not out there, and we're not making sure that the information out there is credible, you know what's going to end up happening? They're going to get their information from elsewhere. They're going to get their information from anti-vaccine healthcare professionals who are not up to date with their information, who have an agenda, who are been misled, misinformed, whatever you want to call it. We want to make sure that we are there being proactive, and we are being there to show them that vaccines are safe, vaccines work, and you can come to us with your questions. With that, it's your turn. So I really hope that after this webinar, you feel empowered to use your social media for good. There are several hashtags you see there that are often used in the pro-vaccine advocacy world on social media. You have hashtag vaccines work, hashtag end polio, hashtag #VaxSelfie if you get a flu shot or a booster, hashtag Nurses Who Vaccinate, Nurses Who Vax, and hashtag Nursing Life. You can follow myself and my colleagues on our channels. You can find us on Twitter and Instagram and Pinterest, Facebook, at Melody Butler. You can find Nurses Vaccinate at Nurses Who Vax. Voice of Vaccines is the following. Shot at Prevention is the Families Fighting Flu. And Shot at Life is at Shot at Life. Additional resources I'll make available here. These are the organization websites I highly recommend. My citations, because I'm a good little nurse, I always make sure I have my citations. And at this time, I'll answer you guys your questions. And I see I have a question right here. Do you have an example of the case method for the HPV vaccine? This is the one we have a lot of hesitation from parents. Yes. So yes, you could absolutely use the HPV vaccine as incorporate that. Let me see if I could just think of a quick question. Let's say if someone comes up to you and they said, I heard that story of 100 girls dying from HPV. Do you think I should get it? And then I would start off with a collaborate, and I would say, I know that story, I'm familiar with it, it is very scary. And then you go into the A, about me, and you let them know that I have read into that, and I have done an extensive literature review, and I've consulted with the experts and colleagues, and you go into the science, and the science shows that those 100 stories are actually have not been confirmed. They have never been verified to be a cause of HPV. They were entered into a VAERS system, which is the Vaccine Adverse Effects Reporting System. And then when they did the massive reviews of how safe the HPV vaccine is, studies show it is ridiculously safe. In fact, so much to the point, and it's so effective that not only has Australia been able to dramatically and drastically bring down their rates of HPV vaccine and cervical cancer, they've also been able, and Rwanda is the next one to completely eliminate HPV from their country. So the vaccine works, and this is when you get into the advise and explain. Then you would say the vaccine works. I highly recommend the HPV vaccine. If you have vaccinated your children or if you got it yourself, you can say that at this point. And then you would want to make sure that you provide an opportunity for them to ask questions. That was a kind of on the spot, me just doing my spiel for case method. So that's one way you can use the case method, but you see the framework of conversation. I hope that was clear. And I hope you guys can still hear me. You guys still there? Are there any other questions? You're welcome. Thank you, Pamela, for your question.
I think we are all good on this end. If there are any other questions for Melody, you can put them up in the chat box or the Q&A box now. Otherwise, thank you for joining today's webinar. The link to the recording and presentation will be distributed by your state affiliate through email. Following the webinar, you'll receive a brief survey about this platform. Then you'll be sent a separate email and link to our online webinar survey where you can provide us with feedback about today's presentation. Please take a few minutes to complete both surveys. If you're a non-member, consider becoming a member of your respective state affiliate. I want to say thank you to Melody, and this concludes our webinar. Thank you for your participation. Make sure that you hang up your telephone, and have a wonderful afternoon.